Good evening. This is CTV News for Wednesday, October 8th. I'm Rochelle Metzger.
And I'm Sonia Srivastava. Thank you for joining us tonight. The first Ebola patient in the United States has died. Thomas Duncan had been in a Dallas hospital since late September when he succumbed to the disease. News of Duncan's death spread quickly. Now the Obama administration is proposing additional measures to screen passengers here in the U.S. Byron Scott has more from BWI Thurgood Marshall Airport.
The 700 daily flights in and out of BWI Thurgood Marshall Airport, only 20 are international. None go to or from West Africa, but there are, of course, many connecting flights, which means someone with Ebola could potentially pass through BWI.
I travel, my wife usually makes up a special oil brew so I could kind of spray on the seats and stuff like that to help kind of kill the germs as I travel. And kind of little safeguard on my part, kind of makes me feel good, but still it's, something that I'm concerned about, absolutely.
As has been widely reported, Thomas Duncan, the first Ebola case in the U.S., has died in a Dallas hospital. In response, the president has announced new security measures for U.S. airports. In addition, according to the Associated Press, Homeland Security says additional screenings will now take place at U.S. airports.
I'm not convinced screenings are going to assist in a virus moving across the country. I don't know how you would screen somebody for potential viruses.
The specifics have yet to be released. The AP is reporting that agents will be handing out Ebola fact sheets. They will read in part, "You were given this card because you arrived in the U.S. from a country with Ebola." It goes on to say, "Please watch your health for the next 21 days and to take your temperature every morning and evening and watch for symptoms of Ebola."
Well, I'm looking forward to that.
Karen Eddy welcomes the new procedures, but remains very concerned. She and her daughter live in Alaska. They travel often to the National Institutes of Health in Bethesda so her daughter can be treated for a weakened immune system.
So all those kinds of things concern me.
This man is heading home to Knoxville, Tennessee, but he worries about returning to his native Nigeria, even though the disease is not present there.
I'm concerned about traveling home, though, which I haven't done in quite a while. I went home 2 years ago, so the concern is not, I don't have the concern here, I have the concern going home or being in a plane coming back with somebody who might have contracted it.
Byron Scott, CTV News.
Thank you, Byron. Locally here, the Washington Council of Governments held a meeting today to address regional preparation for the Ebola virus. The outbreak in West Africa has been one of the biggest in history, and hospitals in the area are taking strong precautions. The COG board received a briefing from Dr. Daxel Garcia, the director of the D.C. Department of Public Health.
I can tell you most of the hospitals here don't have to even get concerned that they don't have the quality, or not only of the personnel, but the capacity to essentially curtail an infection. Infection control is essentially the surveillance that happens at the community level. It's also in terms of the clinical practice and guidelines to prevent a patient that comes, for example, with any disease that is communicable, including, for example, EVD68, to make sure that no other patient gets infected.
Now, COG also discussed changes going on at the region's three major airports, Reagan National, Thurgood Marshall, and and Dulles.
Prince George's is facing a deficit of nearly $60 million in its fiscal year 2015 budget. The looming shortfall has triggered modest hiring and funding freezes throughout the government. Budget Administrator Tom Himmler told council members Tuesday that if action isn't taken, the deficit could grow and threaten the county's bond rating. On the chopping block are council-supported programs that total about $11 million in this year's budget. Frustrated Council Chair Mel Franklin says members don't agree with the list of identified holds and cuts that the administration sent, so they're not going to go along with them.
It just feels like we're not really, one, addressing the problem completely, though clearly there's some steps in that direction being taken by the administration. But two, I think there needs to be a collaborative effort in identifying the areas of reduction. The council, I think, is willing to make some tough choices, but only if we're making them together and not, as I said, one branch of government telling the other branch of government how it's going to be. And so that's really the pushback.
The Washington Post reports that the council was informed 5 months ago of a more than $65 million budget hole that needed to be plugged. The solution at that time was to dip into the county's reserve fund. Well, members of the Prince George's School Board are under fire tonight for misusing their county-issued credit cards. Local NBC affiliate WRC is calling out at least 2 members, including Vice Chair Carolyn Boston, for spending hundreds of taxpayer dollars in recent months on restaurant meals near the board's offices. The NBC4i team obtained copies of receipts signed by Boston for valet parking accommodations and room service at a hotel near her home. According to the news outlet, Boston was instructed to reimburse the district for alcohol purchases that she made with her county-issued credit card. CTV News attempted to contact the school system for comment, but our calls as of news time went unanswered.
Marijuana may be illegal in the state of Maryland, but much advancement to legalize the drug has been made.
Just recently, a new medicinal marijuana law was passed in the state, giving patients better access to the drug.
CTV's Stephen Graves joins us now and tells us how potential business owners are hoping to get involved with this lucrative industry.
That's right, ladies. It's very lucrative. And if I gave you a number, it's expected that this industry will be worth over $10 billion in the next 5 years. So as you can imagine, a lot of business owners want to get involved in this. There are a lot of steps to take. But just to put this in a little bit of context, Maryland now joins 20 other states and the district in protecting patients whose doctors recommend marijuana use. This means licensed individuals can grow and sell the drug for medicinal use. Today, dozens of potential business owners met to learn about the legislation and hear the best ways to start the trade. Experts from all over the country attended to share advice and answer questions.
There are people in Maryland who need compassionate care. It's time to change the perceptions of marijuana as just a recreational drug, but when you really need to look at how it's helping people with illnesses.
This is a major project they're embarking upon. There are legal issues to consider, obviously financial issues to consider, and they really need to do their homework and figure out who they're going to work with, and also know that this is going to be a major investment of time and financial resources.
Now, experts also say for any people wanting to get involved in the industry, it all starts with education and learning the ins and outs of the business. There are still many details that need to be worked out by Maryland and the Medical Marijuana Commission, such as the prices and regulations to receive a license. And as you can imagine, ladies, it's going to be very competitive. There are only about 5 licenses to own one of these businesses. So.
Wow, and at least other states have already kind of jumped on this bandwagon and implemented it there, so we could use those as models for our system here in Maryland.
Absolutely, yeah.
All right, thanks,
Thank
Stephen.
you, Stephen.
Well, you're watching CTV News. I'm Rochelle Metzger.
And I'm Sonia Srivastava.